In this video, you will learn about the various types of movements synovial joints enable. At the heart of every synovial joint is an intricate structure designed for smooth, efficient movement. These joints are surrounded by an articular capsule, which acts like a protective sleeve. Inside this capsule lies the joint cavity, filled with lubricating synovial fluid. The ends of the bones are covered with articular cartilage, providing a smooth, cushioned surface for movement. Supporting these components are ligaments, which connect the bones and provide stability, preventing excessive movement while allowing necessary motion. Let's start by examining two fundamental movements, flexion and extension. At many joints, flexion decreases the angle between bones, while extension straightens the joint, increasing this angle. However, at the shoulder, flexion occurs when you raise your arm forward, like reaching for something on a high shelf. In the knee, flexion happens when you bend your leg, such as when sitting down. Extension is the opposite motion, straightening your arm back down or extending your leg to stand up. Flexion moves away from anatomical position through the sagittal plane, and extension is the opposite movement that returns the body to anatomical position. These movements are essential for countless daily activities, from walking to picking up objects. Moving to the neck, we see similar flexion and extension movements. When you nod your head forward, bringing your chin toward your chest, that's neck flexion. While most of this motion occurs at the atlanto-occipital joint, these movements involve multiple vertebral joints working together. The vertebral column demonstrates these movements on a larger scale. Spinal flexion occurs when you bend forward to touch your toes, while extension happens when you arch your back. Rotation is a fascinating movement that occurs around the long axis of a body part. In the neck, rotation allows you to turn your head left and right, essential for scanning your environment. Most of this movement occurs at the atlanto-axial joint, but spinal movements usually involve the coordinated action of multiple vertebral segments. In limbs, we see both medial rotation, turning inward, and lateral rotation, turning outward. These movements are crucial for activities like throwing a ball or checking your watch. Abduction and adduction represent another important pair of movements. Abduction moves a limb away from the body's midline, like raising your arm out to the side. Adduction brings the limb back toward the midline. To distinguish these similar terms, you might find it helpful to think about how the first three letters of adduction spell add like addition. If an alien takes you away, you were abducted. Abduction takes the limb away from the midline, and adduction adds it back, returning to anatomical position. At the shoulder, these movements are particularly notable. Think of making a snow angel, where your arms move away from and then back toward your body. These movements are crucial for reaching, lifting, and maintaining balance. The forearm demonstrates unique movements called pronation and supination. Pronation occurs when you rotate your palm to face downward, while supination turns your palm upward. These movements involve the radius bone rotating around the ulna. You use these movements countless times daily. You need supination in order to hold a bowl of soup. Pronation allows you to type on a keyboard. In the foot, we find dorsiflexion and plantar flexion. Dorsiflexion occurs when you lift your toes toward your shin, while plantar flexion points your toes downward. These movements are crucial for walking, as dorsiflexion helps clear your toes during the swing phase of gait, while plantar flexion provides the push-off force needed for forward movement. Inversion lifts the sole of the foot medially, and eversion is the opposite movement, raising the lateral aspect of the plantar region. These movements are essential for maintaining contact with the ground and help us stay balanced. The jaw exhibits protraction and retraction movements. Protraction occurs when you move your mandible forward, while retraction pulls it back. These movements, occurring at the temporomandibular joint, are essential for the complex process of chewing food and speaking clearly. Think about how your jaw moves forward slightly when you bite into an apple, then retracts as you chew. Elevation and depression of the mandible are simple but vital movements. Elevation occurs when you close your mouth, bringing your lower teeth up to meet the upper teeth. Depression is the opposite, opening your mouth. These movements require precise coordination of several muscles and work in conjunction with protraction and retraction for effective chewing, speaking, and yawning. Finally, let's discuss opposition of the thumb, the movement that enables fine control as we pinch our fingers to grasp and manipulate small objects. Opposition occurs at the saddle joint between the first metacarpal and the trapezium, and this movement allows the distal phalanx of the pollex to contact the other distal phalanges. Opposition allows you to write with a pen or pull out a hair with a pair of tweezers.